And what's up, beautiful people? This is your tooth doctor, Maureen Moran. Welcome back again to my YouTube channel. All we do here is talk matters oral health, and it's simply because I believe everybody is entitled to good oral status. So guys, assuming you've had a tooth extraction, 5 days later, you are experiencing a lot of pain from the site where the extraction was done. That is the topic I want us to discuss today, and it is called dry socket, technically known as alveolar osteitis. So this is a dental condition that takes place 2 to 5 days following a permanent tooth extraction, and these ones normally takes place if the clot that usually forms on the socket where the extraction was done has been flushed off, or it has been dissolved, leading to the exposure of the nerve and the bone underneath your jaw before the wound gets to heal well. Normally, this clot serves as a protective layers to these crucial things. Of course, we have the nerve and we have the underlying bone. So if it gets removed before the wound gets to heal fully, then that situation is what we normally refer to as dry socket. Some of the signs to watch out, are rather the signs and the symptoms for a dry socket can be intense pain few days after the extraction was done. You can also have the pain radiating to other parts of your on the affected side. You will also have some foul smell coming from the tooth, or you get bad breath. You can also have unpleasant taste in your mouth, visibly empty socket with missing or partially missing blood clot, and we also have visible bone on the extraction site. Guys, if the extraction is done well and your dentist got to remove the whole tooth structure without leaving anything in the socket, there are some risk factors that can make you feel the excess pain after the extraction has been done. And number one, not following the instruction or the post instructions given after the procedure is done. And just to emphasize on some of these instructions, actually they are very simple things that you are supposed to look out for. If you follow, many times if you follow these instructions, you may not even need the antibiotics and the analgesics thereafter. And they include, do not spit at least for 1 to 2 hours after the procedure is done. This is because, remember we said there's a clot that usually forms on the extraction site. If you spit, and especially you do it vigorously, it is easier for you to get rid of that clot, which is supposed to protect the nerves and the bone that was left after the tooth was removed out. Number two, do not put your tongue there or even your finger there. For instance, if you put your finger, it could be contaminated, and that means you are introducing bacteria to the extraction site. If you keep on putting your tongue there to check, I don't know what you are checking for, the probability is you are going either to force the clot that has already formed to dissolve, or you can even remove the clot. And again, this clot is very important to help you not experience pain as the wound tries to heal. Another instruction that we usually say is that you avoid eating using that side at least for 3 days. You can use the opposite side where the extraction wasn't done. And this one is because it is going to avoid a lot of food packing around that area, which will delay again the healing process. Also, if you really have to drink something of which you are being advised to drink room temperature drinks or even meals, if you have to following the procedure, then if you are supposed to drink anything, you are not supposed to use a straw. Sorry. Drink, if it is a cup or a glass, drink directly and avoid using a straw. There are many post-extraction instructions. That is not what we are talking about today. I only felt like there's need for me to emphasize that because somebody gets an extraction done, there's a lot of pain thereafter, and they are the biggest initiators of this pain. But also another factor can be smoking. If you get a tooth extraction done, kindly do not smoke at least for 3 days so that the wound gets to heal well. Another cause that, rather another risk that can subject you to getting dry socket is gum infection or tooth infection around the area where there was an extraction done. So if the tooth next to where the extraction was done has some sort of infection, or the gum around that area is infected, the infection might get onto the wound, and anywhere there is an infection without it being dealt with, then it can delay the healing process, hence pain after your extraction is done. So, having known that you have a dry socket, what do you do now? The first thing I will suggest you to do is contact your dentist. Once you contact your dentist, then an examination is going to be done, of course, to ascertain that there is no tooth remnant that was left, there is no tooth structure that was left inside the socket. Once that is established, and then your dentist probably is going to check if the clot is there or not there. And then the probability of the clot not being there, of course, is very high. They are going to flush out the wound with some saline solutions and other fluids, which helps to get rid of the germs and the food debris that have probably accumulated on the socket. After that, after the wound is clean and that procedure has been done well, and for your information, don't be worried, it is usually done under anesthesia, so there is no much pain being inflicted at that moment. Once the wound is well cleaned, then your dentist is going to discharge you home, probably with some analgesics to cover you through. But then some antibiotic might be given as well if the wound was infected, and that one is easily noticeable. That is if there is a pus from the affected area or some swelling as well at home. Now this one, you have, the ball is coming back to you as an individual, because whatever you do will determine the healing process. Please maintain good oral hygiene. Oral hygiene is important. Sitachoka kusema that statement. It is really very important. However, when you are brushing your teeth, please be careful such that the bristles of your toothbrush don't get to touch that area, because for sure it is going to be quite painful or very uncomfortable. Rinse with warm salty water at least 2 to 3 times daily. That is after on the following day after cleaning your teeth well. Complement that with the warm salt water. Use the prescribed medications until the pain or the infection has subsided well. You can as well put some ice on the side of the face, where the problem is being felt. This one can help in easing or creating some temporary numbing as you get to heal well, especially if the pain is too much. Lastly, choose your foods well. Try and avoid foods that are going to irritate the gums and maybe make you experience more pain. Yes. So guys, I hope you've gotten to learn something. Thank you so much once again for always staying tuned to this channel. Let us meet in my next video. Bye bye.